More than 19 million Americans are diagnosed with depression, and an estimated 20 million more are undiagnosed. These statistics have become the overnight topic of conversation in the wake of Robin Williams' death.
Williams was very public about his depression and substance abuse, but for many there is a stigma attached to mental illness, and many go untreated or lack a support system, we know. So joining us now is psychiatrist Ken Robbins from the SSM Healthcare Wisconsin Group, and actually a national expert on depression and suicide. So welcome.
Thanks for being with us, Doctor.
Thank you very much. Nice to be here.
Now, the news last night of Williams' suicide really seemed to shock everyone. Do you think that there could have been some warning signs?
Yes, I think there were likely warning signs, but what a horrible tragedy.
Absolutely.
What happens when someone goes from being deeply depressed to suicidal? What's the trigger?
Well, the trigger isn't always the same. You know, one needs to compare what the risk factors are versus what the protective factors are. So the things that tend to put people most at risk for suicide are the degree of depression, the severity of anxiety, the use of other substances that might be somewhat disinhibiting, the degree of stressors that they are struggling with, and to some extent their support systems can sometimes be somewhat protective, but often people keep this hidden from their support system, so people don't know that they've reached such a desperate point.
What if you are part of the support system and you feel like you see some signs and you want to reach out to someone? What is the best way to approach them, in your opinion?
That's a really good question, because people tend to be afraid that if they ask someone if they're feeling suicidal, that it will somehow put ideas in their head. And there have been a number of studies that have shown that is simply inaccurate. And in fact, what one wants to do for someone who you care about, who you're afraid might be feeling suicidal, is to offer them support and to give them a chance to talk about how they're feeling. So you ask them, are you feeling depressed? And then you build up to asking them if they're feeling suicidal. You ask them, for example, are you feeling hopeless? Are you feeling like there is nothing that can help you? Have you actually considered taking your own life? And people tend to be honest about how they feel. They often will tell you how they feel, because most people are ambivalent. They aren't absolutely certain they want to commit suicide. And having a chance to connect with someone and talk about it can be incredibly helpful and actually life-saving.
And we're talking depression. It's a mental disease, correct?
It is a mental disease,
Treatable?
and we're learning more. I'm sorry, go ahead.
Treatable?
It is very treatable. I think what we're learning is that depression is far more than simply a sad mood, but it actually affects body physiology and puts people at risk for a number of illnesses. It affects the immune system, it affects inflammation, it affects all sorts of physiologic processes. But yes, it's treatable, but it's critical that people get in for proper care, or this can lead not only to medical illnesses, but to hopelessness and ultimately to suicide. And there are now over 1 million suicides worldwide per year. This is a very frightening outcome of depression, and it is increasing. It's been gradually increasing over the years.
Well, this will open up a lot of new discussion, and hopefully people will get treated and get help. Doctor, thanks for being with us today.
My pleasure.